All right, good afternoon and welcome. Thank you all for being here. Despite the impending snow, we really appreciate having you here today. My name is Amalia Almada, and on behalf of the Planetary Health Alliance, we're really thrilled to welcome our special guest, Dr. Sharon Friel from Australian National University. Thank you also to our co-sponsors, the Harvard Center for Population and Development Studies, the Department of Environmental Health at Harvard's T.H. Chan School of Public Health, the Center for Health and the Global Environment, and the Harvard Center for the Environment. So the Planetary Health Alliance is based at the Harvard T.H. Chan School of Public Health in partnership with the Harvard Center for the Environment. We're actually the Department of Environmental Health's newest residents. I think we're moving at the end of the month to Building 1, and we're really excited to engage with the community here more. The Alliance is a consortium of over 130 institutions from over 30 countries, and all committed to advancing research, education, and policy in planetary health. Planetary health is an emerging field focused on addressing the health impacts of accelerating global environmental change. We really encourage you to sign up for our listserv, check us out on social media. We'll be hosting other events like this at Harvard, but we also would love to engage you with our global community as well. The Alliance sees a focus on health equity as core to planetary health. As human activity continues to affect our global food production system, the quality of the air we breathe and the water we drink, our exposure to infectious diseases, and even the habitability of the places where we live, who will be most impacted? The health risks of these environmental changes are not fairly or equally distributed across people, communities, nations, or even generations. Environmental change will only further exacerbate existing health and social inequities, hitting those already vulnerable the hardest. Safeguarding our health in this new era of global environmental change will require understanding and addressing the root causes of these inequities. So we thank Dr. Friel for being here today to share her thoughtful and timely work. I'll leave it to Dr. Nancy Krieger. Thank you.
Hey everyone, I'm likewise glad that you're here today. My name is Nancy Krieger. I'm a professor here in social behavioral sciences, but I'm also the editor of this new series with Oxford University Press on small books with big ideas for population health. And if we show, it's really truly a small book. Everyone is restricted. And this is the second book in the series, and it's completely timely given the times that we live in of immense concerns about both global climate change and about health inequities and the dearth of literature and work that is connecting the two. And it was really wonderful when Sharon agreed to the offer to write a book that would link these things together in a way that would cut across many different fields, be appealing to people who are in the social sciences and epidemiology and policy and environmental health, and also to speak in a really clear, plain language about what to do. As I emphasize in the introduction, this is not a time for despair. It's a time for action informed by realistic kinds of hopes and change. And the book also very usefully builds on the second book, on the first book in the series, which is actually by Professor Jason Beckfield, who's chair of sociology over at Faculty of Arts and Science, which was on political sociology and the people's health, and provides a very short guide that's completely relevant in terms of what are the rules of the games and who sets the rules of the games and how can they be contested in terms of who and what is shaping the population's health, driving health inequities, suffering the brunt of injustice, and how can that be changed. So I encourage you to think about both of these books. They're available. You can read them through the Harvard Library System online, as well as also take them out, because they're very short and very accessible. Each is only 3 chapters. That's all that's allowed. And they really do provide a source of real resource to understand where you can go much further in learning and connecting the issues and bringing that to the work that you do in your everyday life as well as in your academic research or in the policy work you do or wherever it is that you're heading in the activities that concern you about having sustainability and equity on this planet. Let me just say a few words about Sharon, who I had the good fortune to meet many years ago and connect also when I was on sabbatical many years ago in New Zealand and got over to Australia when Sharon was there and invited me over as well, with an interest in part at that point also on Indigenous health issues. But she's currently a professor of health equity and director of the School of Regulation and Global Governance, also known as RegNet, at the Australian National University. She's the director of the Menzies Centre for Health Policy at ANU. She's a fellow of the Academy of Social Sciences Australia. Between 2005 and 2008, she was the head of the Scientific Secretariat of the World Health Organization Commission on the Social Determinants of Health, and her interests, as you will gather, are in the political economy of health, policy governance and regulation in relation to the social determinants of health inequities, including trade and investment, food systems, and climate change. So without further ado, Sharon.
Thank you. Thank you so much for the invitation to come and do this from the Planetary Health Alliance, from Nancy, the School of Public Health. Really a pleasure, even though it's freezing cold. When I left home, I live in Australia, I'm Scottish, but I live in Australia, and when I left home it was 40 degrees Celsius. So this is just a little bit nippy. So another spruik for the book. Please go out and buy it. It's really easy. You can just pop it in your pocket and read it when you're sitting on the bus or the train or whatever. So what do I want to talk about really, and what's in the book? So the idea of the 3 chapters, and Nancy sort of said it as if, oh, it's dead easy, it was 3 chapters. This was probably the hardest thing I've ever done. You know what we're like as academics, you know, keeping it brief is a challenge, well, certainly for me. But so the way I've broken it up is, yes, starting with the facts of despair, and what I've spoken about in the book is this consumptogenic system, and I'll explain a little bit more about that. But I really do want to echo Nancy's comments about really the needs for hope. It's just so important within the issues that I'm going to speak about, bringing together climate change and health inequity. If we immerse ourselves in despair, this whole agenda is so overwhelming. But there are many, many things that are already happening and that can be done. So let me start with the despair part, though. Let's get that bit out of the way. So many of you in the room will be familiar with this idea of the planetary health boundaries. The work of Will Stefan and colleagues really, I think, laying out very clearly that we are already in a place where some of these life-supporting systems are reaching a state where human social development is going to be incredibly compromised. I'm not going to go into the specifics of what's up on the screen. The green is good and everything else is not. And so you can see we've got a number of areas where we have real concerns. There is no question whatsoever that climate change is happening, that the world is warming, and of course what that means is we see all sorts of extremities. You've had incredible cold here, we've got incredible heat in Australia, but are we getting to a place where the level of 1.5 degrees Celsius, it's not very far away. So by, according to the IPCC, by about 2040, so that's in about 20 years' time. Yeah, that's not a long time at all. We'll be up above the pre-industrial levels. Will be 1.5 degrees Celsius above that. And that is very, very concerning. We are already 1 degree Celsius above those levels. And we're seeing the effects. So climate science is so important. The environmental science that wraps around all of that is so important, and there is no denying where we are with these problems. And what are the impacts of these sorts of climate change? So of course we're seeing more extreme weather events, we're seeing more fires. I'll show you an image of Australia shortly. We're seeing the melting of glaciers, we're seeing incredible flooding, we're seeing incredible sea level rise. And of course that varies around the world, but it's happening more intensely, it's happening more frequently, it's happening, and it's happening to everybody around the world. What's that going to mean for health? So I'm drawing on the work of a great mentor of mine, Professor Tony McMichael. So Tony, way back, well, this is from some of his work in 2013, he's sadly passed away, but I'm sure many of you are familiar with his work. But Tony was sort of laying out some of the direct ways in which some of that climate change, those impacts in terms of extreme weather events, the heat waves, and all of the ridiculous air pollution. So I was in Bangkok a couple of weeks ago, and schools had to be closed down because of the levels of air pollution. Interestingly, they were using molasses to absorb the particular matter out of the air to try and do something about it. That was an interesting technical response. But of course, some of the health impacts that flow out from that you can see listed there. But there are many other ways that climate change will affect health. So some of the impacts on those biophysical systems leading to some of the sea level rises and the other things that I've listed there. How is that going to affect health? Well, we see it flowing through. So we'll see differences in food yields. I'll come to this. We see the changes in mosquito populations happening already around the world. In Australia, where I live, we're seeing mosquito moving further south in the country, and much further south in the country compared to ever before. We're about to go off to countries in the South Pacific where some of the malaria and dengue has just reached levels that were unprecedented before. And then some of the other ways. So what happens when agriculture gets impacted by the changes in climate? Well, people lose their jobs, people lose their livelihoods, so that starts to affect income security, that starts to affect people's mental health, people's concerns about the future. So there's a whole load of different ways that climate change, and I'll try and reflect Nancy's work of the embodiment, it gets under our skin and into our heads in ways that will last for a long time on into the future. But of course, that doesn't happen equally at all. Climate change will interact with all of the social inequities that already exist in the world today and will affect health inequities around the world. Everybody will be affected by climate change, but it will not affect everybody equally. This is a quote from Kirk Smith, another climate change and health researcher here in the US, and you can see just really this difference in ability in terms of adaptation in particular as he speaks about the rich and the poor. So you have all of those sort of pathways from climate change to health and health effects sitting alongside the social determinants of health. And this picture, so this is from the East End of Glasgow, where I'm from. It's from a photographer, Joe Mackenzie, who's called this exhibition The Witness to Mortality. So the East End of Glasgow has a lot of areas that looks like this. So where I'm from is where men now live until the age of 62 on average. 62 is, how ridiculous is that? Compared to more affluent parts of the city where it's up above 80. And what you see in the picture, I think, is this confluence of the physical, the social environment in which people go about their daily lives. Now, there are, of course, ways of adapting to all of that, but you see questions of urban design, you see questions of transport. There is no public transport in this part of Glasgow. So how do people move about, and particularly if you've got financial resource constrictions there. So you've got climate change sitting alongside some of these social conditions that already exist. And we know that the health outcomes are poorer in places where society is more unequal. We can spend a long time talking about this slide, but we won't. Really, the point that I'm just trying to convey here, this is of course in high-income countries, but inequality within a country matters for health. Yeah. So I hope you see where I'm going with this. You've got all of this issue of climate change, You've got all of these social conditions that are already there, that are affecting people's physical and mental well-being. And you've got inequality within countries, between and within countries, that we know matters. This is really just to demonstrate, again, the inequities of the impacts of climate. So this is just from climate change. It's very old now. If I had put the map of the world in terms of life expectancy up on the screen, and you'll have seen, you know, the global life expectancy maps, it would be completely the opposite to what's up on that screen. And so what it's really saying is those countries where there are already very low levels of life expectancy because of all of those sort of social conditions that I've been speaking about, they are then having this sort of double whammy, as it were, of climate change, and that's just the climate effects there. Just to try and bring it into the US, so when Nancy mentioned that I was working with the Commission on the Social Determinants of Health, and David Satcher, former Surgeon General for the US, was part of that commission. David invited us, it wasn't long after Hurricane Katrina had hit in New Orleans, and we were invited to come, and in the commission to come to New Orleans, not specifically about Hurricane Katrina, but what that discussion really opened up was this intersection. So there was this incredible, well, people were calling it a natural disaster. There was nothing natural at all about Hurricane Katrina, as, if we agree that climate change is human-made. So you've got this extreme weather event that there were 2,000 deaths. The ongoing mental trauma from Hurricane Katrina, it still exists. But what Hurricane Katrina really showed was the social fault lines. That was the discussion that was coming up at our meeting in New Orleans, and particularly in areas like the 9th Ward. So people who were very socially disadvantaged, who didn't have transport to get out of the city at the time, for example. And I show this really just, again, to illustrate when you bring something like extreme weather events into a locale where you have inequalities in social conditions, and you can think about a whole load of different social inequities that are at play, then some of the health outcomes and the deaths become very socially structured. So that was the facts of despair. I could talk for hours about the facts of despair, many of you, I'm sure, in the work. So I'd sort of mentioned about the climate science, but of course the incredibly important work of social epidemiology that sits behind a lot of the information that I've just been speaking about, the evolution of eco-epidemiology, so ecosocial theory, the eco-epidemiology, really important for getting us to a place where we can understand how these different factors are coming together. What I've done in the book is start to bring together this idea of consumptogenic systems, and very deliberately locating it in a systems perspective. So let me unpack that a little. So I'm not going to read all of this. This is from a report from McKinsey. And my basic starting point around consumptogenic systems is we have a global economic system that is predicated on fossil fuel and that is predicated on more and more economic growth for the sake of it. And what I think this captures is how that is happening. So we have a corporatized world. And I'm going to show why I think that's really problematic for the sorts of things that I've just been speaking about. If we accept that we have an economic system that requires more and more, or that is trying to achieve more and more economic growth for the sake of it, what that also means is there is more and more profit and wealth being generated. Remember, I've been speaking about some of the inequalities, and I'll come back to that in a wee second. What sits alongside that sort of model is more and more use of fossil fuels. So This is the graph of fossil fuel use over, well, you can see over the centuries. And so we know from a climate change perspective, it's the excess use of fossil fuels that's incredibly harmful in terms of greenhouse gas emissions. And so we've got coal, oil, and natural gas contributing to that quite significantly. So it's not, I don't think there's any surprise whatsoever that we see the level of climate change that we have today, given this trajectory of economic development over the past, really since the Industrial Revolution, and the use of fossil fuels. On the front of The Economist, as I was sitting waiting this morning, The Economist was sitting there, and it speaks about big oil and climate change. The front cover of The Economist saying that we have to do something about big oil and climate change. I think that's a sign of the times that things are really, people are concerned. So if we have a system that is predicated on the use of fossil fuels for a whole load of products, of commodities, of services, we are all using that on an everyday basis. That system, I argue, makes it really easy for us as individuals to consume. And that's partly a price thing, not exclusively, but it's partly a price thing. This is just a little illustration to say what has become more expensive over time, some of those public goods relatively, and what has become cheaper over time. I would say the sorts of things that are absolutely non-essential for a healthy and sustainable life. So if we're to think about some of the drivers, some of the levers for changing our consumptogenic world, we might start to think about how items are priced, for example. And of course, that consumption, again, is not done in an equal way. This was some analysis that was done by Oxfam that fed into the World Economic Forum, into Davos, showing that inequity in the emissions, they call it these lifestyle consumption emissions, and you've got about 10% of the world's wealthiest people contributing to about 50% of those emissions. So the picture really that I'm trying to paint is one of, we've got a consumptogenic system driving the use of fossil fuels, and it's not happening equally around the world by different cuts. You can see, again, just in the countries, I'm afraid North America and Australia have this terrible badge to wear in terms of being per capita one of the biggest emitters in the world. And remember, thinking back to the image that I showed of the climate change related deaths in that global map, it was the countries that are in the middle here in Africa, sub-Saharan Africa in particular, where the effects of climate change were being felt most acutely, but of course are being the least emitting countries. So again, another way of cutting the inequities within this whole space. So I want to focus on the food system. I do a lot of work within the food system, and I'm going to argue, as a consumptogenic system, I'm going to argue that the industrialised food system is one of our big problems. At the moment, the food system is set up from a commodity perspective. Remember the time when food used to be about, the meaning of life, and you'd sit down together around a table and enjoy food. It really has changed. So all the way from production through to processing, through to the retail environment, through to the food service sector, through to what's on the plate. Foods are about commodities, they're about financialisation of products now. And the externalities from that industrialised food system, I argue in the book, is the harm to the environment, which I'll speak about in a wee second, and then what that means from a health perspective. And right now, we have about 1 billion people who are undernourished, and we've got about 2 billion people who are overweight and obese. So macronutrient deficiency, undernutrition and hunger, sitting alongside overweight and obesity. And there's a whole myriad of health concerns that arise from those figures. So sitting alongside what people would argue have been incredible developments taking place within agriculture and food systems, I think what these figures point towards is that we have some sort of failure taking place in that system. And so what's driving it? Arguably, so remember, we're trying to understand what are the drivers of consumption, what are the drivers of use of fossil fuel, what are the drivers of excess consumption of the products that are produced by those systems. What the evidence would suggest is the greater liberalisation of trade and investment, which brings much more increased foreign direct investment, so big companies coming into countries, and then the advertising and marketing. So let me just pause it. So don't look at the Philippines. I don't want to get into the technicalities of this slide. I want to focus on Vietnam. So this is all about trade and investment. So Vietnam wants to open up, become part of the global trading system. That's a very sensible thing from an economic development argument. That's what countries aspire to do in terms of economic growth and so on. So part of the requirements of becoming part of the multilateral, the World Trading Organization system is the liberalisation of investment for companies to come into countries. There's a whole load of other things you have to do, but that's one of the things. And what happens in Vietnam when they liberalise that investment sector? What we see on the graph is, the takeaway is the growth in the sales of sugar-sweetened carbonated beverages. Now, from a health perspective, from a public health perspective, we don't really want people to be drinking sugar, junk, Coca-Cola, PepsiCo. But the sales, so you can see the rate of growth in sales. So trade and investment agreements, I think, have a real opportunity to help the health of countries. If we were to think about health considerations within trade and investment, so there's a number of us are pushing for health impact assessment within trade and investment for new agreements. Why is Vietnam a really interesting country? So Vietnam is one of the countries that is part of, well, what was the Trans-Pacific Partnership Agreement, and that's changed now. Vietnam is a huge market. So Australia's in it, New Zealand is in it, the US was in it. I would imagine it'll probably come back into some new form of it. These are new big regional trade agreements that are completely resetting the global trading rules. And when you've got the opportunity to reset the global trading rules, why can't we do that from a health perspective? There is also no consideration whatsoever for the environment in these decisions that are being made. So sitting at the table in trade, so I often go and meet with the trade minister or the trade negotiators, and I say, please can you, in the negotiation of a new trade agreement, please can you take into account, health or nutrition in that? And they'll say, why would we do that? That's not our business. We're about trade and investment. And when you then start to sort of demonstrate some of the feedbacks, I'm going to get to systems in a second, but when you talk about the feedbacks coming in to harm the environment and harm health, they'll say, oh, we had no idea about that. What do you want to be included in the trade and investment agreement? And that's where we need to have, as a public health person, we need to have relations with lawyers. So connecting with the legal scholars becomes incredibly important and incredibly helpful. So we're starting to see, I think we're starting to see some real opportunities opening up. But at the moment, the trade and investment regime is about pushing more production and more consumption of these sorts of foods. So so that's not good from a health perspective, and so that sort of system is not good from an environment perspective. So the estimates are that the global food system is contributing to around about 25-30%, depending on what figures you look at in terms of greenhouse gas emissions. That's huge. I mean, imagine if we could get a global food system that took environmental considerations and that took health considerations into account. The shift that we could do in terms of the reduction of greenhouse gas emissions, it is no surprise, therefore, that agriculture has been very deliberately kept off of the table in some of the big negotiations, and I'll come back to that in a second. How does it happen through the food system? And I've sort of jokingly called this eating oil. It happens everywhere. So remember, this is about the use of fossil fuels as a major underpinning of this global consumptogenic system, and in this instance the food system. You can see the use of fuels all the way through the food system, from agriculture through to consumption. Of course there are other things, there's other things in there. But if we could do something about the types of fuels that are being used to drive, to support, to enable our food systems, wouldn't that be an incredible success story? But we're not there yet. Because if we don't do something about the food system in terms of greenhouse gas emissions, let alone the health outcomes, but if we don't do something about greenhouse gas emissions, we then have this feedback because climate change is affecting the agricultural system's ability to produce. And so you've got changes in agricultural yields from the IPCC report, so reductions in all over the place in terms of core primary commodities. And this is also having an effect on price. So if our food system is about food availability, food affordability, food acceptability, and all of that matters in terms of people's health, and the food system is contributing to environmental harms coming out sort of this way, and then that's coming back to affect food availability and food price, and therefore affordability, we've got, I think, quite a serious issue. You might have seen the recent LancetEat Commission that was launched a few weeks ago, and Walter Willett here in Harvard was co-chair of that. Within that work, I highly recommend having a look at that. It's a very important piece of work, I think. Within that, they speak about a reference diet, a healthy and sustainable reference diet. And really what it's all about is saying really lower the consumption of red meat and increase the consumption of plant-based foods. That's the key message. And we're globally nowhere close to complying with that sort of dietary recommendation, nowhere close. So it's a health policy question, it's an agricultural policy question, and it's also a social policy question. We did some analysis in Australia to say, okay, if we were to have a healthy and sustainable diet recommendation, based on this, we were way ahead of Walt and colleagues, we did this a few years ago, but it's just in Australia, and we priced what a healthy and sustainable diet would look like and what that would be then relative to, in terms of affordability, relative to the cost. And the takeaway message from that is for people in low-income households, they would have to spend somewhere between sort of 40 and 50% of their weekly income to comply with a healthy and sustainable diet recommendation, which is nonsense. You know, once you get above a sort of a 30% level, then you push people into financial insecurity. So food becomes a discretionary matter at that point. So we've got this big policy question, I think, don't we, that we've got to do something about a healthy and sustainable food system, healthy and sustainable consumption, but then that begs questions of what do we need to do within trade policy, what do we need to do from a social policy perspective that helps people to comply with this. So how do we change the system to get us there? And I'll try and wrap up in the next 5 minutes or so. How do we change the system? Dead easy. So a 5-point plan, yeah? I say this glibly because of course it is just so difficult, so difficult to do any of this. But this is sort of drawing on, it's drawing on political science, it's drawing on policy processes, and I do a lot of work in policy research. it's drawing on the literature from social movements as well. So this really is now, I hope what I've sort of demonstrated, for researchers in the room, the importance of climate, environmental science, the importance of different forms of epidemiology, the importance of, I'm going to speak about policy research, political economy research. So a shared vision, what do we want? Yeah, so again, this all sounds incredibly easy, but what we know from the literature is to galvanise, or if we think we've got a problem, how do we as a community in this room, a community in Boston, a community at the national level, at the global level, what do we galvanise around? And what I hope that I've pointed towards is the idea of economic growth in and of itself, just for its own sake, is not good enough. It has got us to the problems that we're in right now. And the idea of using economic growth for the public good, surely that's the point of growth within a country, to look after the people. And imagine if we had energy policy that was saying, yep, it's not just about the big energy companies getting to keep all the profits that it continues to grow. Remember the figures that are the quote that I was showing from McKinsey earlier on. Again, orienting energy policy. Well, first of all, having an energy policy. We don't have an energy policy in Australia. It's problematic. And then the way I've spoken about the conditions that support everyone to flourish, that's those sort of the social determinants factors that I've been speaking about. Social policy, urban design, planning policy, really that looks after everyone. And then, of course, always paying attention to the environmental impact of that. The importance of systems, of thinking and working and researching systems. You don't need to look at the details of that at all. Because people say to me, oh, for God's sake, that's just far too complex. Look at it. It's just too messy. It's overwhelming. We just can't do anything about that. I look at that, and there's two things that I take away from that. One, there are many, many entry points for action. Yep. So you might work on urban design for active transport. That really matters in that system because of the way it flows into a whole load of other things. You might work on thermal stress. That really matters. It's connected. So there's many places to intervene. You don't have to do all of it. No one person does all of this, but your role in that is really important. The other thing about systems thinking is it tells us that things are not static. Complex adaptive systems are adaptive systems. And so therefore things change, things can change. And we as people in those systems have agency to create the sort of change that we want to see. So if you agree with me that these consumptogenic systems have to change, there are many ways that we can change them, and that we as actors in that system have agency to make that happen. But it does require us to think of all of this in systems terms. I would say we've got so much evidence. I'm not going to read through this. The intention is not to go through each of these points. But what I would say is, have a wee look at the LancetEat Commission on Obesity. That also came out very recently, a week after the LancetEat Commission. And that was all about really recommendations for action around the global syndemic of malnutrition in all its forms and climate change. So I don't think we need any more evidence about the sorts of things that needs to be done. I shouldn't say that to a room full of researchers, because we always do need more evidence. But there's loads of things that we know should happen. I do think as research, and it happens at multiple levels, but I do think for us as researchers, and this gets into more of that, the policy analysis and the political economy of these systems that I've been speaking about, as researchers is to understand those systems better, to understand the politics. So it's dead easy to say, yep, we need to do something about fossil fuel production and consumption, and we need an energy policy that focuses on that, and we need a policy that has an equity lens to it. That sounds so easy to say, but politically it's a nightmare. It's an absolute nightmare. And it's not a per chance thing. There's a whole load of factors that's working to affect that. And so why don't we see the sorts of actions that we might want to see? So perhaps 3 reasons. So why are governments so reluctant to implement the sorts of regulatory policy actions that we might want? Well, this constant proposition that market-based solutions is going to get us out of the problems that the market-based approach has caused, I think it's an old argument. And then the other one in Australia is, well, we will educate the public and that will solve the problem. It's important, but it's certainly not the whole solution at all. But that's our policy response, and I know that's what happens also here in the US. And then regulatory chill. So when a government is being lobbied, is being bullied by some of the big corporations to say, no, you shouldn't be introducing that particular sort of energy policy, or no, you shouldn't be introducing a sugar-sweetened beverage tax. We're having this going on at the moment in Australia. Then they back off. Government backs off, they chill, because they're concerned that they're going to be sued. And particularly, one of the things that I didn't say in the discussion around trade and investment is part of trade and investment agreements is what's called the Investor-State Dispute Settlement Clause, and that allows, in some of them, and that allows companies to sue governments. So a company can take a government to court and sue them. So if a government wants to really take on a big policy issue and a company is saying, oh, this is very problematic, then they back off. I'm getting the wee clock signal, so I'm not going to go through all of them because I want to get to the hopeful bit, which relates to the bottom point of the demand for government action from civil society and the public. And this is my second last slide, so we're almost done. So the idea of hope, of networks of hope, and so the social movement literature tells us that it is really important for the collective, and the collective around a shared vision. And I highly recommend it was a special issue from the journal around hope, power and governance. And there are all sorts of things that have been bubbling up over the past number of decades that are bubbling up now that are very important networks of hope, I would say. And what you can see some of them listed there, the Planetary Health Alliance, so important, particularly bringing together the disciplines and the sectors together. But what social movements allow us to do is lift the consciousness around, I think, some of these egregious inequities that we're seeing. It allows a mechanism for holding governments and the big corporates to account, and it allows a mechanism to say there is an alternative and this is what it could look like. So there wasn't an awful lot of hope in there. I don't think it's very hard sometimes with these sorts of agendas to really get to a place where you can see the kind of the pathway forward. But I would say, and using a quote from Martin Luther King, which of course was all around social injustice, really it's incredibly relevant right now that we are very angry, that we are thinking about the sorts of research that will make a difference in some of these consumptogenic systems, and that as social movements in all sorts of shapes and forms, we're showing what those alternatives might look like. So thank you.